Hey everyone, welcome back to another episode of Doctors Go Live with me, Nina Sharalkhan, your host. And today we are talking about taking the burden off your neck by understanding cervical spondylosis. Now, let us know who's tuning in, where are you tuning in from, and do share with us if any of you are suffering from neck problem. How long have you had it, and what would you like to know in today's episode of Taking the Burden Off My Neck, Understanding Cervical Spondylosis. And now, with every new episode, if you share this video out, you get to take part in our Doctors Gold Live quiz, which is happening right at the end of the Q&A with our doctor, where today you get to win some stainless steel cutlery sets and fridge magnets. So if you want to win, let us know in the comment, all right? So all this is happening right here, right now on Doctors Go Live with me, Nina, and our special guest for today is consultant neurosurgeon all the way from Columbia Asia Hospital, Bukit Rimau, Dr. Yee Sze-Voon. So also, before we start today's episode, I would like to share with you guys that this is our third year of hosting Doctors Go Live. Now, that's 3 years of Doctors Go Live, and we've covered so many topics. We've even had Malay, Chinese, and English episodes too. And some of you have been with us since we first started. So thank you so much for your support, and your response have been amazing. Now, moving forward, hopefully another 3 more years. So we would like to know, what would you like us to cover? What topics, what illnesses? So feel free to let us know in the comment so we can sort everything out and get those episodes for you. All right. So for today as well, if you've been experiencing neck pain and stiffness, most of the time we think that rest, ice, and compression or a little massage will be able to sort it. But sometimes the underlying cause may be something more than you know. You could be suffering from cervical spondylosis, but what exactly is cervical spondylosis? How do you treat it? And can it be cured completely? Well, that's what today's episode is about. Today, we are going to dive deep into this topic. We're going to discover the causes, the symptoms, and how it actually affects our daily lives. And most importantly, can we prevent it? So we'll learn the various treatment options available and find relief from cervical spondylosis. Now, if you know someone who would appreciate this information or would find this super useful, if you think this is such an important topic and you want to share it to make a difference out there, please do share this video out. Tag all your friends and to follow us, because this episode could definitely help somebody out there, okay? And while you're sharing out today's episode, let's take a look at this video.
Are you facing any of these symptoms? Headaches, neck pain and stiffness, radiating arm pain, tingling and numbness in the upper extremities. This is the time. Take control of your neck, starting now.
Sometimes, people over 60 years old tend to complain about stiffness and pain in the back of the neck. This could be their condition due to cervical spondylosis. Due to the current lifestyle, we are seeing an increasing number of younger age group suffering from this condition. To know more about this condition, join me, Dr. Yee Sze-Voon, consultant neurosurgeon from Columbia Asia Hospital, Bukit Rimau, in the next episode of Doctors Go Live, where I'll be sharing more about cervical spondylosis, what it is, and how it affects our daily lives.
Hey everybody, welcome back. My name is Nina, your host for today, and today we are going to be covering taking the burden off the neck simply by understanding cervical spondylosis. All right. Now, here to help us shed some light, please welcome consultant neurosurgeon Dr. Yee Sze-Voon from Columbia Asia Hospital, Bukit Rimau. Welcome, Dr. Yee.
Thank you for having me here today. Afternoon, Nina.
Most welcome. All right, Doc. Before we begin, just to share with everybody, right at the end of the episode, please, we will be having our quiz where we've got stainless steel cutlery sets and fridge magnets up for grab. So do pay attention to our very handsome doctor over here, Dr. Yee, because he's practically going to be giving you the answer. All right. Now, of course, if you have any questions with respect to our topic today, feel free to ask us in the chat, and we'll address them right at the end of my Q&A, my interview with Doc. Okay. And also today, I think we're going to make it very fast, chop, because we're going to get Doc out of here because he's due to go to Seremban. Yeah. So from Bukit Rimau to Seremban, I think is a jam-full area. So do ask your questions and we'll get into it straight away. Okay. All right. So Doc, let's begin. Before we begin, Doc, can you share with us I mean, we'd love to know more about you. Can you share with us a little bit about you, what you do as a consultant neurosurgeon, and how did you start in neurosurgery? Yeah.
Well, we neurosurgeon, I would say that we don't only about a lot of concept that neuro, right? I mean, people will just think of the brain itself, but actually, neurosurgeon, we do cover anything that is related to the brain, the spinal cord, and the spine. Because the fact that the spinal cord lies within the spinal canal, our spinal cord lies within the spinal canal, the spine itself. So anything related to that will be related to us. And having said that, pain itself is also due to a nerve compression most of the time, or nerve damage. And a lot of times we deal with the nerves. So that is why a lot of times we have to work a lot with the nerves, the brains, and the spine as well. Well, to say,
Not
how
just
do I
brain.
get started? No,
Yeah,
no,
how did
no,
you get started?
yeah. How I got into neurosurgery, there's a long story. I mean, well, I always liked doing surgeries, you see. And then just an opportunity when I was way younger, then I got a chance to be in the neurosurgery ward in one of the biggest centers in Malaysia, 𝘋𝘰𝘓𝘵. So, well, the working environment and I saw how team works just make me fall in love with the field of neurosurgery. And when I go into the OT, it just mesmerized me even more. Well, never once, we used to do surgeries with just our naked eye. But when I went into the OT, I saw, wow, we are actually doing surgeries with microscopes. So that kind of like mesmerizes me even more. It inspires me. Okay, come, let's go into this field right now.
Wow, so that's how he fell in love with nerves, with surgery, right? Okay, so definitely the guy that we want to speak to because he loves everything about this, right? Okay, cool. Doc, so let's start from the very beginning. Oh, no, before that, Doc, why is it important that we talk about today's topic? What are you hoping the audience will take home?
Well, to be honest, I'm pretty sure that every one of us here has experienced some sort of neck discomfort, neck pain, neck stiffness, and it's affecting our life so common that the fact that we tend to neglect it. Is it something more serious that we kind of ignore it, or perhaps it's just something very mild? So it's good to to let people know more about this thing, which is so common in our daily lives, and just let them know a little bit more. Educate. I always believe that education is the key to preventing this very common disease from it getting worse, number one, and to educate people to have more knowledge about this disease itself.
Okay, got it. So it can be prevented. So that's what today's about. It's all about awareness. So make sure you share with your friends and family. Yep. So, all right. So let's get into it then. Doc, let's start with the very basic. What exactly is cervical spondylosis, or is it cervical spondylosis? Help us, Doc. What is it?
Well, I mean, cervical is just it's just an accent. US will say it's cervical. I mean, the British will say it's a cervical. So it's the same thing actually. And the spondylosis is a very general term. So what it means is actually a degeneration of the spine itself, a degenerative condition. So it can be affecting the bones, the disc, the joints, or the ligaments within the spine itself. So any of these parts are affected, or degenerates, it can be called a spondylosis.
Right. So basically it means degeneration of the cervical or cervical, depending on whether you want to be British or American, right? Kind of that area kind of thing, right? Okay.
Yep.
Which area does it affect? Does it cover, Doc, when we talk about cervical?
Yeah. So as you can see, our cervical spine is divided into seven levels. They have seven spines that consist of this cervical spine. Okay. So and each of it, as you can see on the two pictures that I've actually shown on the screen right now, that this joint, it's very complex and it's very important because it carries our head. You see, it carries our brain. And it protects the most important part of the body, the spinal cord, the main wire that connects the brain and the rest of the body. So that is why it's number one, it's important, it's complex, not only within the bone itself, it has so many structures there, from the arteries, from the veins, to the nerve that comes out from it. And you look at the muscle that's covering around it, it's so thick. That is why, because there are so many structures in this area, and there are a lot of fibers or things that can cause pain, and a lot of degeneration can happen to so many components, like our cars, right? The more components, the easier that you get damaged and a lot of wear and tear. So same goes for our cervical spine.
Right. Okay, cool. So who does it affect? How common is it, first and foremost, and who does it affect the most?
Okay, so it actually affecting the age group between 50, 60 years old, the most common. I mean, this is the most common age group that is affecting. However, we are seeing an increasing number of percentage of the younger generation is being affected by these conditions. We are seeing more and more younger group of patients having this pain in the neck, stiffness. And by 70 years old, even at 60 years old, if you do an X-ray to the patient, you'll find 90% of the person who undergone an X-ray for the cervical spine will have some, means on X-ray that they will have some degeneration happening. However, maybe out of this 90%, perhaps about 40 or 50% will have symptoms. Means you can see something on the X-ray doesn't mean you might have the symptoms. Okay, it just shows that it's a wear and tear process as we age.
So if it's a wear and tear, that means everybody's going to have it. It's like 90% of the population, so we better be aware about it. Okay, kind of thing. So so if this condition is increasingly affecting our younger generation as well, is it because of lifestyle?
Definitely.
What are the risk factors here?
Yeah. As you can look at the picture that I put up here, the left side, I think that is how we are leading looking at our phones every single day, looking downwards, head protruding forward. So that kind of like a posture is totally not ergonomic at all to our cervical spine because it increases the load to the cervical spine. All the joints, all the ligaments can be at risk of being overused because of this posture. As we go to the next slide, I'm going to show you every inch that we slouch forward will increase the stress on our spine itself. You see, in a normal condition, at the left-hand most, our head is somewhere about 5 to 6 kgs. 2 inches forward, that weight increases by almost 10 kg. 3 inches forward, 15 kgs. Can you imagine if you are constantly carrying a 15 kg load in a non-ergonomic posture, like what is shown on the most right-hand side of the picture here? Okay, can you imagine how much stress your joints, your spine is going through every single day? And you imagine we are up for almost 16 hours or more.
Wow, this
16
is
hours. Yeah, 16 hours is a long hours.
That's not even like, if you think about it, if you're saying 15 kilos, that's not even one baby. That's almost 2 babies, right?
Yeah.
2 Asian babies lah, at least, yeah?
Yeah.
So this is serious. Okay, got it. So let's take a look. Okay.
So here, as you can see, what I put up here is what will happen, you see. So when you have such a heavy load on your neck and it's constantly in stress, of course, something will get wear and tear. So the most common thing that we always see is what we hear is a slip disc, correct? So slip disc does not even, it does not confine to the lower back region. Anything within the spine has a disc in between. So when it gets stressed out, there will be protrusion of the disc, compressing on the spinal cord, which is that structure covered in the reddish color covering. At the same time, you also protrude toward the side where you can see the 2 nerve endings comes out.
So the yellow color, is it?
Yeah, the yellow color root at the 2 o'clock and 8 o'clock. So you can see that it protrudes out to the side. You will not only compress the spinal cord, you will also compress the nerve root, giving up to the pain. As I mentioned earlier, the cervical spine also consists of a lot of joints and also a lot of ligaments. So the ligaments will also get thickened as a result of stress, as a result of overusage. So that thickened ligament will also cause narrowing of the spinal canal, the place where the nerve root comes out or the place where the spinal cord stays within the canal. All this will cause further narrowing of this structured canal and causes compression towards the spinal cord and also the spinal nerve roots.
Okay, got it. Wow. Okay, so how do we know? This sounds serious. How do we know if we have it? What are the symptoms?
Yeah. Well, the most common symptom that most of us has is actually the central neck pain, right, at the back of the neck. So that most of us will have experienced it some way in between our lives. So we definitely have it. We have some stiff neck, Okay, but what it can happen is this pain can go up to the head, at the back of the head, and mimic like a headache. Okay, and sometimes when it compresses more towards the side, as shown earlier, it will radiate down to the arm, like your shoulder, at the back of the shoulder where your shoulder blade is. Sometimes you have that kind of very weird dull pain. It could be a result of the cervical spondylosis itself.
Wow. Okay. So this is really interesting because you get headaches, and I thought the cause of it is the cervical spine. So how exactly is it connected?
Okay. So you look at the picture here, right? Because the nerve that supplies the back of the head comes from the second and the third nerve from the cervical spinal cord. So that itself, when there is degeneration towards these joints, so these nerve endings will be damaged or will be in an injured state. And because of that, you will get headaches at the back of the neck. At the back of the neck, that radiates up to the back of the head. This is how it happens. And I circle up all those areas that is shown here. Basically, these are where our nerve endings lies. And any degeneration to these areas will give you that central neck pain or the side of the neck pain. And don't forgetting muscle itself. I shown earlier that there are a lot of muscle covering the neck. This muscle also has nerve endings whereby when it's overusage will also lead to pain in the neck.
Wow. Okay. So since we're talking about neck pain, can you elaborate the neck pain? Are there different types of pain?
Yeah. So I kind of like classify them into based on duration, you see. Like the acute one is like, there are different like locations as well, but I think time frame will be an easier way to classify them. Like from the acute, like a short duration, anything that up to 4 weeks. Usually these are quite self-limiting, means that they will come and go. Okay, I'm pretty sure that we have woken up with a sore neck, and we all know that after 2 days, 3 days, it will just goes off. It will go off completely. Yeah. So these are the kind that we are talking about. The subacute ones are a little bit longer. They are looking between 4 weeks to maybe 3 months, and chronic are anything more than 3 months. Wow. So I'm pretty sure a lot of times it will fall into category of the acute ones.
Acute ones.
Less will be the subacute and the chronic ones. When they come to subacute and chronic ones, means something. I would say a more chronic process is happening, such as the degeneration of the cervical spine itself is happening already.
I see. Okay. Yeah, and when does it become dangerous? You know?
Okay.
Yeah. What kind of pain are we talking about? Yeah. Or when is it too late?
Okay, so basically, pain is always a signal that where the body is telling us, okay, something is not right. Okay, so it just reminds us that, okay, you are not in a normal state. It's just a reminder. So the red flags that we're talking about are when this neck pain causes you to have weakness in either side of your arm, okay, or lower part of the leg. All right. When there is weakness, means that the compression is severe enough that the nerve cannot function normally to transmit the signal, to tell to move the hands or to move the legs already. This is definitely a red flag. Okay? Following weakness, sometimes we might even get shooting pain. So shooting pain is also a sign of compression, but it haven't reached the state whereby it's causing weakness. Okay, it's just a state where the nerve is being compressed, and it's telling you that, okay, something is compressing me. I'm telling you that there's a shooting pain that's happening right now. It's an electrical like shooting sensation. It's very classical, and people will tell you about it. Okay,
which area though?
It will shoot along the arm. It will shoot along the arm. Okay, it can be either the back of the arm or the inner side of the arm, depending on which nerve is being compressed. Most commonly, we always see at the back of the arm here, because that particular C5, C6 level is the most commonly affected joint, because that is the most mobile joint.
Okay.
Yep. And not forgetting, the last red flag we are talking about when there's numbness that's happening, tingling sensation. Tingling sensation and numbness, these are a sign of a chronic compression, whereby the nerve already starts to, degenerates a bit and it's not so healthy anymore. And that's a sign of like another subtle signal that it's telling you that, okay, please get yourself checked. Please get yourself checked.
Okay. So
So
this red flag, either one of the three or all three, then I go to the doctor, or either one of the three?
either one of the three, when you experience it together with the neck pain, you should seek professional opinion already.
Okay. So either one of the red flags together with the neck pain, go and see Dr. Yee. Okay?
Yeah.
All right. So now that we know what the symptoms and then when it's really time to see, let's talk about the diagnosis. How is cervical spondylosis diagnosed?
All right. Okay. So usually we will start off with history first. We try to ask what exactly happens, how it happens. Okay. And then before we move on to a more clinical examination, then we will examine and see where exactly is the pain coming from. Is it coming from the middle? Is it coming from the side? Or is it somewhere else that we are looking at? And then we also have to check the arms, check the legs, make sure there's no weaknesses, and we look at the sensation. So we basically will do a thorough physical examination to make sure what we are dealing with before we want to go proceed with the next kind of like the radiological imaging, such as X-rays. So one might ask, I mean, in such a modern era, why is X-ray still is important? Well, X-ray is super important because X-ray is the simplest, most effective, fastest tool that we can utilize to tell us whether the bone itself is in a healthy state or is already in a very degenerated state already. So before we move on to CT scan, because CT scan will give us more information on the quality of the bone, the alignment of the bone. As you can see on the left-hand side of your screen, that is how a normal CT cervical should look like. Beautiful edges, the color of the bone is all similar. As compared to the right-hand side, the right side of the screen, you can see the alignment is off. And you can see a lot of unwanted white color behind the bone there. Okay, so these are all the things that we can pick up from a CT scan. Okay, X-ray might tell us, but CT will tell us even more in a three-dimensional way. Okay, then lastly, the MRI cervical will tell us how our spinal cord or the nerve root is being compressed, whether there is a very bad compression or whether there's a very mild compression or whether the canal itself is very narrow. All these we can gain from the MRI itself. The soft tissues will tell us, basically the MRI will tell us about the soft tissue condition.
Okay. So,
Yep.
So now that we've diagnosed this, if someone does have cervical spondylosis, what are their options for treatment?
Well, treatment-wise, I always like to tell my patients that there are always surgical and non-surgical method, and we always start off with the non-surgical method. So the non-surgical method we are talking about is usually what we call the physiotherapy or the medications that we are commonly exposed to. Okay, so and a lot of times it will be a multi-modality kind of a treatment whereby we not only utilize a single one. For say we only use physiotherapy. No, we actually kind of like combine with different methods of physiotherapy, or we'll combine it with medical therapy. We'll add on some medication to help out with the pain. Because if the pain is so severe, there's no way you can move. There's no way you can stretch. Okay, so it's like always a combination of each treatment before we go on to the next step, which is the injections or the interventional procedures that I like to call them, the surgery.
Okay, got it. So what are some non-surgical options available and are they effective or not?
Yeah. As you can see on your screen, I have kind of like summarized most of it. So those most of the time with fresh, with icing or hot pack, it usually will relieve the symptoms. Okay, and you can see sometimes I even put like exercising, doing some what is that called, going to some TCMs or taking some over-the-counter medications. Yeah, so those will help as well. There is no, I wouldn't say which is more effective. It's more of like seeing what you are having, whether you are having more of a muscle strain or is it a bony pain. So different condition warrants different sort of stretching exercise or different kind of a conservative, more conventional approach to it.
Okay, got it. So when do we start looking into surgical treatment, or when is it an option?
Okay. When there are reflex, okay,
Mhm.
and when the pain gets so bad, it's affecting your daily activities. It's affecting you so badly that you can't even do your daily stuff. Okay. That is the
Mhm.
time when you should consider interventional procedures already.
Mhm.
So, yep. So basically, the interventional procedures that we're talking about could be either injections
Mhm.
or could be surgeries, open surgeries. So the
Okay.
injections also, yeah.
Uh, are these what are the risks associated with injections and surgeries?
Mm.
Does it really work? What are the success rates, if you could share with us?
Okay.
Because I hear a lot of people when it comes to, they say, ah, yeah, no difference lah, the surgery. So
Yeah.
what do you have to say about that? Yeah.
I would say that the most important thing is to look at the indication and look at the patient's scan and symptoms individually. No single patient is the same.
Okay.
Finding the correct solution to each patient, tailoring a personalized treatment for each patient, that is most important. Having said that, each, whether it's a big procedure or small procedure, carries risk. Whether the risk
Mm-hmm.
is high or low, well, a lot of times we are talking about cervical spine. Cervical spine, like I showed earlier, has a lot of structures there. Of course, more
Mm-hmm.
structures, more risk of damaging that during surgeries or during the
Mm-hmm.
procedures. But because we know what we are doing, we can minimize the risk to a very manageable percentage and increasing the success rate.
Okay, got it. So, what about other? When we talk about interventions, what are some interventions that can be done, and how
Yeah,
does it help? Mm.
yeah. So the injections that we're talking at, we are looking at differentiating. First of all, we have to differentiate whether the pain comes from the joints or the
Mm-hmm.
pains comes from the disc, or it's more of like the nerve itself has been compressed for a long time and causing that kind of neuropathic kind of a pain. So
Mm-hmm.
we can tailor different sort of the pain. I mean, tailor the injection, different type of injection, tailored towards that. So in a way, it's like a targeted kind of a treatment.
Mm-hmm. Okay.
Uh, yeah, yeah. If there's a disc problem, we can always target the disc. We can inject, we can reduce, we can do some injections to the disc. We basically what we call nucleoplasty. We re-string the disc to a extent where it's not compressing. We cannot shrink it completely, but we can shrink it a little bit to prevent compression. The whole idea is to reduce the compression towards the nerve, which is causing the pain.
Mm. Okay,
Mhm.
got it.
As for the joints, yeah, that's what I can show here. As for the joints, we can inject directly to the nerve, which is innervating the joint. In a way, it reduces the pain fibers that's being transmitted from there. Okay. As for surgeries as well, I like to divide it into whether the problem comes from the anterior part of the spine or posterior part of the spine. There are surgeries for the back part of the spine, there are surgeries for the front part of the spine. So I like to always put it in a simpler nutshell in the sense that is the problem is from the front, we come from the front. Problem is the back, we come from the back.
Okay, makes sense.
Yeah. Yeah.
Right. Okay. Now, all this is for individuals who've been diagnosed with cervical cancer, right? Due to wear and tear or lifestyle kind of thing. But are there any lifestyle modifications or preventive measures that we can take to reduce this, especially since 90% of us are going to end up having it? Just wondering.
Yeah, definitely. Number one, I would say less TikTok lah.
Oh, yes. Because TikTok, you're like this and you can spend hours on it,
Basically, we
right?
are just constantly looking down on the phone, basically. So yeah, we have to definitely be more aware of the posture that we are looking when we are using our phones, because we are so we are basically sticking to our phone 24/7. So I think it's a good thing that we should take breaks from using the phone and just taking stretches in between and reduce the stress on the neck. Prevention is always the cure, because if we might not be able to prevent degeneration, but we can at least slow it down. You
Okay,
see?
I like that. Slow
Yeah,
down the
yeah,
degeneration. So, what are the things we can do?
yeah. We can always maintain the proper postures. A good ergonomics will eventually slow down your degeneration, just like how we drive, right? If we're going through bumpers without braking, of course the car will go to the workshop more frequent as compared to someone who takes care of, going through bumps, going slow, no sudden brakes. Of course, the car will definitely last longer. Same goes for our body joints, you see. So a proper ergonomics will reduce the risk and slow down the whole degeneration process. And stretch in between. Do not maintain a posture longer than 1-2 hours without changing, them. As you know, we are so focused in our work sometimes, right? Especially in front of laptops, right? Desk jobs, your head will be stooping forward. We all know that we'll be stooping forward for a very, very long time. And end up by 5 p.m. we head home, we'll be end up with a very sore shoulder and sore neck.
Yes, indeed.
Yes.
Right? Okay.
Lastly, not forgetting, stay active, because by having a strong muscle, it will give the extra support the bone requires, you see. As I showed earlier in the first two pictures, right, there are bony elements and the muscle elements, right? The muscle elements are the first. It's okay. So basically, we know that the neck is being supported not only by the bone, our brain, our cranium is not only supported by the bone itself, it's also supported by the muscles. Okay, having a strong muscles will take the load off the spine.
Okay.
Hence, it will also slow down the degeneration.
Okay, got it.
Yeah.
And
Always listen to your body. Yeah. When there is pain or there is soreness, it's the body basically telling you take a break.
Okay, got it.
Yeah.
Definitely. Right. So I think we're so not in tune with ourselves, our body, that we don't listen to it. So I guess this is a very good reminder to listen to your body, and then don't take it for granted, right? So Doc, now that we know all this, in your experience, being in this area for so many years, what do you think is the most common mistake that people tend to make when it comes to cervical spondylosis? Where are we going wrong? Yeah.
I would say our lifestyle. Despite saying that, this is actually not good for your spine health, the posture is so important, we still do it.
Okay.
Yeah. We realized that, we were told, okay, not to use your phone so much, not to look down too long, everything, but yet we are still seeing so many people is doing it. That's why it's affecting so many people right now.
Right. Okay. Even the younger ones. Do we have data on how old is it starting then?
I've been seeing younger and younger patients coming in with a spine that looks like a 50, 60 years old.
When you say younger, like what age are we talking about?
The youngest I'm seeing is in the 20s already right now.
And this is something that usually happens in the 50s, but it's already happening in the 20s. It's all because of this lifestyle lah. And also, what can you share with us about this, Doc? Something must be happening that,
Well, I also realized that a lot of times, right, I think it's more of like our Malaysian demographic, our Malaysian population kind of thinking. They do not want to go to the doctor unless it's super, super, super bad. So sometimes what happens is, when it gets so bad, there's only certain things that the doctor can offer, you see. If we kind of like catch it early, we kind of like tell them, okay, let's start off with some lifestyle modification first. Okay. It could have prevented it and stretched the degeneration process to a longer period. And he or she might not come to see a doctor so soon. You understand?
What I've seen doctors, where are they going? Just wondering. When it's early.
I think most of us have seen some videos, or I would say the people would always prefer to go to the alternative medicine kind of the group of practitioners. So where they will seek for the perhaps I would say something interventional, but something not so drastic, such as an open surgery or injections, such as massages.
Sometimes you think headache, like sakit neck and stuff. Asians are probably do it, urut, or do the crack thing, right? So maybe you can advise how do we coexist? When do we go see a doctor? Who do we see first? How can we coexist, with having the Asian lifestyle of the kra and massage and seeing a professional expert? What's your advice?
Yeah. My advice is always, at least let a doctor examine and make sure there are no red flags that is present, okay? And perhaps a simplest kind of investigation such as an X-ray and look at your bone health, joint health before even actually embarking on the fact that, to go see a TCM, go a masseuse to get a massage, everything. And this is a very sensitive area. And my own personal experience is that a lot of times when there are people who have gone to those alternative practitioners, masseuse, without a proper scan and end up being paralyzed after the whole procedures. So this is why, unless it's already been cleared, try not to get your head cracked. If just a simple massage, I think that's fine. But cracking the head, that is definitely something I wouldn't recommend without knowing what's your condition.
And come on, we're seeing all this on social media, right? And it looks like, kind of thing. But you never know, you might have a condition. So always get that expert professional help where you can see the right structure, with all the x-rays and whatnot. Yeah. Okay. Hope that makes sense. So at the end of the day, Doc, if there was one message that you would like the audience to take home from this episode, what would it be?
Prevention is always the best cure. Okay. Have good ergonomics. Okay.
Have good ergonomics. Okay.
Yeah. That's very important. Poor ergonomics equals to acceleration of your degeneration.
Wow. Okay. Fantastic. Okay, so there you have it, ladies and gentlemen. Super insightful session. I learned a lot of things. What is your biggest learning from today's? Would love to hear from you in the chat. Let us know what your biggest takeaway is, right? Okay, we're going to go into the Q&A right now. Let me just quickly go up. Right at the top. Okay, what's the biggest thing you learned? Let us know in the comments section. Yeah, okay. So there's a question from Momo, 30 years old and below. Does that mean budak-budak pun kena? Can kids also? Can it start with kids? Because we're all on social media, Doc. Have you seen any cases? Please share.
The youngest case that I've been asked is a 16-year-old. But that was an active chat, okay? Rugby player.
Oh, rugby. Okay, so it could be due to sports
as well. It could be due to sports as well, contact sports as well. Yeah.
Okay, got it. Okay, so you said that slip disc can also happen further up, not just at the bottom, right? Kind of thing. So can it be sembuh kalau pergi urutan traditional or go to doctor? I think this is so important, and this is an example of what we spoke about. So what's your advice here, Doc?
Well, the slip disc, it won't come back, you see. Okay, it will not just, with time, if proper rest everything, what it will happen is there will be less compression on the nerve. That's all. It will not go back to a state like how it was or how it's supposed to be, like 100% normal disc. It will not. Okay, it will only reduce with rest and probably with physio. It might improve, but it will not be cured 100%.
Okay.
That's why a lot of people will think that, okay, now I don't have pain because after I rest everything. It's because when there is no longer compression on the nerve, the bulge is lesser. Okay, but it doesn't reverse back to a 100% normal state. It's just that it is lesser. That's why there's no pain, there's no compression, there's no pain.
I see. Okay, but would massage still help or no? Physiotherapy.
Physiotherapy probably. Yeah, stretches. Okay. Yeah.
Stretches, physiotherapy would probably help more. Okay, Nicole's question is, does cervical spondylosis cause dizziness or vertigo? We know headaches, but does that include dizziness and vertigo?
This is a fantastic question. This is something that we are seeing more and more common. I like to call this a extra musculoskeletal cervical facet syndrome. It's a very long term. Okay, basically to summarize it is anything to do with the cervical spondylosis, supposedly to have pain at the muscle, pain at the joint. Okay, but we are seeing this is related to dizziness and vertigo. Reason being, the nerve endings that is supplying the neck area has this proprioceptors. What does proprioceptor means? It controls our positional awareness. So when these nerve endings are injured, the positional awareness will also get injured. And this will send signal to the brain telling you something is wrong. So that's why we feel the spinning sensation. So it can happen.
Okay, fantastic questions, Nicole. Well done. Okay, Animal's question is, I have numbness on my left arm. It was diagnosed by the orthopedic as pinched nerve. Currently, I'm in chiro treatment. Numbness still comes and goes. Fingers will swell, if not numb, but less often with treatment. Should I consult a nerve specialist?
Well, when there is numbness, we have to see how bad is the numbness, where exactly is the numbness. Definitely seeking anyone which has expertise in this field. It can be a spine surgeon, it can be a neurosurgeon, or it can be even a neurologist, which sometimes can be something else, you see. So it's definitely good to get it checked properly as well.
Okay, got it. So you would highly recommend her to get it checked with any of those experts you said. Okay, Wilson's question, what about thumb weakness? Could it be a neck issue? Together with tremor of thumb, could it be cervical spondylosis?
Okay. Weakness of the thumb can be due to the cervical spondylosis, because this is actually one of the C5 nerve root, C5. C5. So probably that one particular fiber that is controlling the thumb is being more compressed, that's why causing the weakness. Tremors, not so. Tremors is usually not so much. But one would say that sometimes that kind of weakness is very difficult to differentiate. Very different to differentiate, you see.
So I guess for Wilson, which thumb is it? Kind of thing, right? Yeah. But definitely if it's that thumb, it could be. Yeah.
It could be.
Yeah. Okay. Natasha's question is, hi, what type of neck exercise can reduce neck pain?
Well, in a way, stretches always, I like to put it very simple. You look down too much, look up. You look up too much, look down.
Okay.
Always do the opposite direction of what you are overusing. For example, like I said, you look too much down, just look up, or just turn left, right, something that is opposing.
Okay. Sounds good. I think that's a really
simple. Something simple.
Yeah, thank you. But of course, it didn't occur to us, right? Okay. Question from Cecilia. Before we go to the quiz section, should I see a spine surgeon or neurosurgeon for neck pain? What's your advice, doc?
I mean, of course, I'm a neurosurgeon. I mean, there's you can either see a spine surgeon and a neurosurgeon. If I'm a neurosurgeon, of course, I would say you can see a neurosurgeon, but there's no right or wrong to this answer. Both also we can treat. Both we can see.
Go see both. How's that? Cover all your base. That's my advice, right, doc? Yeah. Anyway, you guys usually chat with each other, right? Kind of thing? Yeah. Okay. Yes. So we're going to go into the quiz now. But before we go into the quiz, if you found today's episode super useful, let us know for future episodes of Doctors Go Live, what would you love for us to cover? Or what illness or which part of the body would you like us to cover? To have more information, do let us know in the comments section, okay? All right. So let's go into the quiz right now. All right, it's quiz time. As mentioned earlier, there are some stainless steel cutlery sets and fridge magnets up for grabs. But what do you need to do in order to win? First, you got to be sure to share this video out at least 3 times, and remember to share the post to public so that everyone can see. Next, answer the 3 questions that we're going to show on the screen in a single comment, and you're on your way to win the prizes. So let me repeat that. First, share this video out 3 times. Remember to set the post to public so everyone can see. Secondly, answer the 3 questions that we're going to show on the slide, in the next slide, in a single comment. Make sure you answer it in a single comment, and we will select the winners based on the correct answers and shared post. So are you ready? All right. Let's take a look at the questions. The first question is, the age group that is most affected by cervical spondylosis is 20 to 30 years old. True or false? When it comes to cervical spondylosis, a headache is one of the most important red flags that should be taken seriously. True or false? And number 3, surgery is the only known treatment for cervical spondylosis. True or false? Let me repeat the question. The age group that is most affected by cervical spondylosis is 20 to 30 years old. When it comes to cervical spondylosis, a headache is one of the most important red flags that should be taken seriously. True or false? And the last question is, surgery is the only known treatment for cervical spondylosis. True or false? So please make sure you answer your question, the questions in a single line, and you're on your way to win the prizes. All right, while waiting to hear who our winners are, if you find that today's sharing is super useful and you want to know other things, or you want to cover other topics, let us know in the comment what other topics you want us to cover, and we'll sort it out right for you, and you'll see it in the future episode. So let us know in the comment section. Let's continue with our Q&A while we're still waiting for who our winners are. This is a fantastic question here, Doc. From Fatiha Abdullah, who's a dietitian. She's asking your opinion on omega-3 fatty acid as an inflammatory food. Does it help cervical spondylosis? Let us know.
Well, there's no proven study to talk about this, that omega-3 fatty acid actually helps with the pain or helps with the degeneration. So I guess the answer is, well, as an inflammatory food, maybe, but as a food that will slow down the degeneration, I don't think it is.
Okay, got it. Kind of thing. Okay, so this question is a bit half because Ara actually was asking the question while we were talking just now. His question, the question we were talking about was, why is it that the younger generation is also suffering? You know, we're seeing more cases of the 20-year-olds having a 50-year-old problem of cervical spondylosis. And Ara is asking, is it because, you know, these kids are carrying heavy bags? Or what is it?
I would still attribute it to the lifestyle. You know, we are sticking to too much gadgets, those kind of things, rather than spending time outside playing. You know, as kids, right, spending time outdoors. I think they're focusing too much on the technology stuff. So I guess that is more of the issue instead of the heavy bags. I think sometimes going out, you know, it helps actually.
Okay.
The heavy bags, I don't think is a reason where you will get cervical. Maybe you will get it's more of the lumbar, the lower back.
Okay, this one is a very, I think, basic question. But it's still important. Do pillows affect neck pain? Does the neck pillows actually relieve neck pain? What kind of pillows is that? Good pillows.
Well, I would say it's a very personal thing, I would say, but a pillow is supposed to support the head while we are sleeping. Right? So it cannot be too soft, cannot be too hard, but it has to be maintaining, it has to help our neck maintain the ergonomics that we are looking at.
Okay.
The normal curvature that we're looking at. Okay? So I would say yes and no to this question.
This is a continuation, by the way. I see many pillows, mattress companies claim therapeutic effects. Is it really true and worth buying?
I would say this is it's just, I would say this is a very personal kind of like opinion, but most importantly, like I've said just now, it has to be something where it can support your neck in a very neutral ergonomic position. And that is something that you can find. Go ahead and get it.
Okay, got it. So it's personal preference, try it. If you like it, yeah. But must support your neck. Okay. Chan Lee Hong's question is, hi, Dr. Yee. If I go for annual health screening, is there any test I can do to check my spine health? That's a really cute way of saying it.
Yep, I guess we can always get it screened in terms of the annual health screening kind of thing, just to get a simple examination or perhaps an X-ray of the neck. But I don't think you need to do it annually unless you really have the symptoms.
Right. Okay. So an X-ray is good enough to first check.
First check and examination, but most importantly, you must have to get it checked if there's no symptoms. Even though you have something in your spine, that does not mean we need to treat it. We just, like I've mentioned, it's more of like, you know, maintaining a proper ergonomics that is most important.
Okay, got it. All right. So Ghana's question: does TENS help with cervical spondylosis? I'm not sure what TENS is. If you could share, Doc.
Well, it's just another mode of what is that called, the physiotherapy. So what happens is TENS actually will relaxes the muscle spasm, you see. So in a way, when the pain is due to the muscle spasm, of course, TENS will definitely help. But if, let's say, the pain is caused by impinged nerve, the TENS won't help.
Okay, got it. Okay, cool. 3 more questions. Nicole's question is, can amitriptyline help me out? Does it help?
Amitriptyline is not really a medication where we use to treat cervical spondylosis. It's more of like a kind of like another way that we can treat pain, headaches. So as we always have to find what is the root cause of it, then we can give the correct medication.
Okay.
You see,
But
so if it's due to if it's due to a bony pain, amitriptyline definitely won't help.
Okay, got it.
Yeah.
Okay, cool. And Cecilia's question is, can I look up and play with my phone? I usually hang my neck on the edge of the bed. Actually, what's the best way of using the phone, since we're always like that? Like they say,
it's always like looking up. I think that's the best way. Or if you look down, just don't be too long in that position. Just remember to just take breaks.
Got it. It's like when you were growing up as a kid, the mothers say, if you put your head out, too much, you will look like that for the rest of your life. So I guess this is where you need to do one of those things, right? Yeah, kind of thing.
Yeah.
Okay.
Yeah.
Okay. Last question before we go to the winners. Siti Zakia Said Mustafa is asking, I've been diagnosed with cervical disc herniation 2 years ago, specialist discharged with 𝘋𝘰𝘤𝘵𝘓 90 mg and 𝘋𝘰𝘤𝘵 𝘓𝘪. I'm sure Doc can pronounce better. But since last week, I have stronger pain at neck, right hand, and headache. Usually, what will you do next?
Well, again, I will get a full history again. Basically, this warrants a full set of history taking, examination, and a new sets of investigations, because, like it's mentioned here, stronger pain means that it's a progression of the symptoms. Means something is getting worse. So yeah, this is definitely what I'll do. I'll definitely go through a set of examine history, and then new sets of investigations, such as either the MRs or CTs or X-rays before what I would do next.
Okay, so Siti, I would just say come over and Siti Dr. Yee terus. Okay? Habis cerita. All right, cool. So that's all the questions that we have from the audience. And now, how many of you guys would like to find out if you won our cutlery set and the fridge magnets? Let's take a look at the winners of the quiz. But before we look at the winners, let's take a look at the right answer. Yeah. Okay. All right. So we have our winners. So let's take a look. The first question is, the age group that is most affected by cervical spondylosis is 20 to 33 years old. True or false, Doc? The first question, Doc, the age group that is most affected.
Yeah, it's definitely false. Yeah.
It's actually 50 to 60, is it? Or 60 to 70?
Yeah.
Okay.
50, 60. Yeah.
50, 60. When it comes to cervical spondylosis, a headache is one of the most important red flag that should be taken seriously. True or false, Doc?
False.
All right. And surgery, the last question, surgery is the only known treatment for cervical spondylosis. True or false?
False.
All right. So if you got false, let's find out who our winners are. All right. The winners are MCC Ching, or 𝘋𝘰𝘤𝘵, like McD, I guess, Ara Devaharan, and Muhammad Imran. Congratulations to all our winners. All right. So if you are MCC Ching, Ara Devaharan, Muhammad Imran, keep a lookout on your Facebook Messenger, because we're going to send the details of how you will be getting your prizes over there, right? So make sure you check your Facebook Messenger inbox. Thank you so much, Dr. Yee, for today. We have definitely learned a lot. Let's give Dr. D a round of applause, okay, before we say goodbye. And I'm afraid that's all the time we have for today. We hope you learned a thing or two. Let us know in the comment what episodes or what topics you would like us to cover, and we'll get right on it. If you know anyone who would appreciate today's tips and insights from today's show, please share this video out, because you never know who you're going to make a difference to. So that's all from us today. Do give us a like and lots of love while you're at it. Thank you so much. Take care of yourself and each other, and we'll see you in the next episode. Bye.
Bye. Thank you.